The causes of lameness in small ruminants, the symptoms, the characteristics, and the treatment. The non-infectious causes are trauma, laminitis, as well as interdigital hyperplasia and toe granuloma. The infectious causes are interdigital dermatitis, foot rot, contagious ovine digital dermatitis, a white line abscess, pedal joint abscess, and infectious polyarthritis or joint ill. For interdigital hyperplasia, this is a skin fold growing in the interdigital space. It is insignificant at first, but it increases with age. It predisposes further foot problems such as interdigital dermatitis. And for the treatment, you remove the large lesions under local anesthesia, and you also exclude these animals from breeding because it's hereditary. For a toe granuloma, this is a strawberry-like granulation tissue, and the cause is over-trimming of the claw. It can also be caused by foreign bodies and chronic foot rot as well. The signs are lameness and bleeding of the corium. For the treatment, have careful excision with a scalpel, and put a pressure bandage on for 3 to 5 days. And for prevention, have proper hoof trimming. For interdigital dermatitis, the cause is wet conditions. It decreases the skin integrity. It is caused by Fusobacterium necrophorum. It is only at the interdigital area between the claws. The signs are moist, red or grey skin and hair loss and pain. For treatment, give a zinc sulfate bath and tetracycline spray. For prevention, it's impossible to eradicate Fusobacterium necrophorum, so just have adequate hoof care. For foot rot, the cause is Fusobacterium necrophorum causes necrosis, and then Dialicobacter nodosum enters, and then this causes deep damage. The signs is pus and smelly discharge and sole separation. There is no sole separation in interdigital dermatitis. Foot rot also causes severe lameness. For the treatment, have zinc foot baths as well as systemic antibiotics such as penicillin and streptomycin. And for prevention, have dry pasture and biosecurity and vaccinations and proper hoof care. For contagious ovine digital dermatitis, the cause is unclear. It's probably caused by treponema. The signs are horn detachment and severe lameness. For the treatment, give a zinc foot bath and systemic antibiotics. For a white line abscess, the cause is a white defect along the abaxial wall. It gets contaminated and then pus forms. And the signs are lameness. For treatment, have hoof trimming and tetracycline spray. For septic pedal arthritis, the cause is interdigital infection, which then spreads to the interphalangeal joint. For the signs, one joint is affected and then severe swelling happens, and then it occurs in the interdigital space. For treatment, have an amputation through the P1, not the joint. So you basically remove half the toe. For infectious polyarthritis of lambs, also known as joint ill, the cause is bacteremia from Streptococcus or E. ruseopathy. The signs are worse in the carpus and the hock. And for the treatment, give acute penicillin for 5 days and NSAIDs for 3 days, and the prognosis is bad. For osteoarthritis in older sheep, the cause is a degenerative condition following trauma. It usually happens in the elbow or the stifle in sheep around 2 to 5 years old. When it occurs in the elbow, they'll have a lower head and the hind limb is forward. They also have decreased joint flexion and thickening of the synovial membrane. For treatment, give NSAIDs for 3 to 5 days. You can also give fenbutazole off-label.